Good afternoon, everyone. Welcome. Thank you for joining our 3 o'clock live brief. I'm going to be short this afternoon. I'm going to turn it over to Scott Jonte and Deborah Jacobson, Winley Gravitt, and Lynn McClintock to bring to you most of the updates. I just have one thing I want to share, and that is an update on our sick resident who's sick with COVID-19 at VCU Health. A little while ago, I spoke with his wife, and she shared that his condition has improved. He is off the ventilator, and he's holding his own. And in fact, she shared with me that twice today she's been able to talk to him and see him via FaceTime. And I can't tell you what that does to the spirit of this place. She also said, and I can't remember exactly what she said, but I think she said he's going to be moved out of ICU either later today or tomorrow, which is just the best possible news, and really we couldn't pray for anything more than that. So keep him in your prayers. He's not out of the woods for sure, but he's holding his own and he's improving, and he's certainly a tough spirit and has been through a lot in the last week. So with that, I'm going to bring Scott on and Deborah, and I'm hoping that they can clear up some of the confusion I left you with when I was on this morning. And so they're going to talk through some of the things I shared, which I heard loud and clear were confusing. So first we're going to start with Scott and then Deborah.
Thank you, John. All right, so I've got a few dining updates today. It's to help streamline our process for everyone, residents, including those loved ones watching from home. As always, I want to say thank you for your patience in this ever-evolving and changing environment. A few updates for you to know about. First of all, due to the high number of calls which are going to the Promenade Dining Room for you to call in and make your meal selection for the evening, we are now creating what is called a call center. We have reestablished some of our point-of-sale systems, our computers to actually take your calls. We're adding in phone lines so we can create a call center-like atmosphere. This is to help facilitate a faster service so when you make your call, you can actually speak to a person. Now, you please understand, due to the high volume of calls that we are receiving, one, it can take up to 30 minutes at times for you to receive your meals. Please keep in mind that last night alone, we fed about 350 people around the campus, all in a home-style delivery service. So it's a little bit of a process, but we're streamlining the operation to make it more efficient for you. Another question amongst the residents is when can we see some printed menus? Many residents like to see things out in advance and know what's coming up. This evening, we will print and put underneath your door a published menu for the next 4 days. This is also going to be available on Touchdown, TV 970 and 71. And if you are familiar with Touchdown at all, there's a Promenade folder menu, which has the actual menu, which is going to be for, again, the next 4 days. As we ramp up our services, we're envisioning next week to publish a 7-day menu, so you can look forward and down the road for your menu selections. The most important thing I think I have to communicate today is this. We have worked out a plan to create an automated meal delivery system. This is for those residents or family members of residents who would like to ensure that their meals are automatically delivered no matter what. So basically it looks like this. You can have 3 meals a day automatically delivered to you without having to call to the dining room. It will happen automatically. We will call you back to check your preferences, but it will be a breakfast, lunch, and dinner comes to you automatically. You can restructure your meal period by saying, well, I only want breakfast and dinner, or I only want dinner. That can happen as well. This is for the type of person who may have some groceries coming in, or perhaps doesn't eat as much. I know that there are some residents who only take 1 or 2 meals a day. So we can structure your automated delivery system based on the number of meals that you would like. Or if you'd like to maintain the current system, you can call in at any given meal period and say that you would like to have a meal delivered. No matter how, when, or where, or what, we will call you back and confirm your meal selection. There are some choices on the menu that we need to make sure that we capture the information correctly, so a member of the dining staff will call you back. Couple of caveats. One is this: if you commit to the automated delivery system for us, what I ask is that you commit to a 7-day commitment. This enables us to make sure that we have our purchasing together, we have our portioning correct, and we have everything set up to ensure that we have meals for everybody who wants them and for those who who truly do want them on a regular system. So again, a 7-day commitment for that. If you automatically enroll and just want this to happen regardless, you will always be automatically enrolled in this process, and it will be left up to you to cancel or change your selections. So once you're enrolled, you're going to be enrolled. You don't need to worry. You won't have to call back. We will call you and make your selections. If you find you want to change or modify your selections, call back, and we will take care of it after the 7 days. Lastly, we have created a dining-specific email address. This is specifically for dining-related issues. The address is dine@wcrichmond.org. Again, dine, D-I-N-E, @wcrichmond.org. You'll get an automated response. I can assure you we will check the emails. A number of my staff and I have access to the mailbox. And this is for very high-level types of communication, only for the dining department. Please enroll my mother on the program. Please modify, things of that nature. With that being said, I'd like to turn it over to Deborah Jacobson.
Good afternoon. I hope I don't sound like a broken record, but I do have to go over a few things that I talked about yesterday for a little bit of clarification. The first thing I want to mention is about the mail delivery. Russell Gardner has been working with Resident Services diligently to get your mail on campus. Unfortunately, even after being told yesterday that it would start back today, we were told this morning that it would not for another 2 weeks. But there is good news. Russell has reached out to Mark Warner and Abigail Spanberger's offices. The Postal Service should not suspend your services, and a liaison from the congressional offices is contacting the Postal Service and hopes services will resume by the end of the day, if not immediately. We'll keep you updated on everything that is going on in that particular area, and we hope it'll happen before the end of the day today, but at 3 o'clock this afternoon, it still had not started back. Then there was a clarification needed as far as those folks that are being quarantined. If you're being quarantined, especially those that have been traveling or because of the theater performance almost a couple weeks ago, you do need to stay in your apartment. If you're not in that list of folks that have traveled or are being quarantined for one reason or another, you are free to take short walks on the campus outside. And when you go outside, we are not limiting where you go, especially for those that want to walk around the pond. We do ask you, if you're walking inside, to stay within your area. Anytime you're walking inside or outside, just put some distance between you. I hope that's some clarification on your walking adventures. Then there was some clarification needed about laundry for those residents who live in the tower who utilize the community washers and dryers. The risk of infection through the washing machines and dryers is extremely low. If you want to put bleach in with your whites, feel free to do that. If you would like to put something like a disinfectant such as Pine Sol in your other laundry, feel free to do that. Again, the risk of infection for something happening is extremely low, and then when you place your items in the dryer, it eliminates that almost completely. Newspaper delivery. Newspaper delivery has been going very well. It's very manpower intensive, but it will continue throughout the weekend. Please be aware that we will have less staff here on the weekend as usual, but the staff volunteers will do everything to get your newspapers to you as soon as possible on Saturday and Sunday. The CVS lines are still overloaded, and this is not just at Westminster Canterbury. From what I gather it's nationwide. If you try the CVS number and you do not reach someone, try again. And if you don't get them after a couple times, feel free to call the clinic at 6231, and the clinic will make sure that your orders are taken over to the pharmacy and filled. I also want to remind you that there are some residents who need some over-the-counter deliveries, and our staff volunteers are working with CVS, and starting at 3:15 today, they will start delivering those to your apartments as well. Update on the grocery delivery, and this is the one thing that makes me the happiest of everything all day long. Available to you Monday, Wednesday, and Friday from 1 to 3, your family members can drop off grocery orders to our shuttle buses that are located in the lot, which is the Azalea lot, which is closest to the courtyard. And that is the lot that, if you were going towards Brook Road, it's the vacant lot right beside Westminster Canterbury. Your family members can drop off groceries at that point. We do ask, and we found today, which is our first delivery, if they're in brown paper bags with your names written on them, it is much easier to make sure it gets to the right person. As of today, we have one bag that's plastic, and we do not know who it belongs to. So a family member calls and says, "Did you get the bag, the brown bag that was plastic?" Please let us know, and we'll make sure that you get that. Call Resident Services 6082. We are continuing with the grocery shopping for you as well. That is happening Monday through Friday. And if you'll place your orders with transportation at 6263 or email transportationrequest@wcrichmond.org, we will make our trips to Kroger's. You have certainly been taking advantage of that, and we'll continue to do that for as long as we need to. My last bullet point here is about transportation. We continue with transportation for essential medical appointments. We are getting a lot of requests now because a lot of people have been waiting for those medical appointments. If it's something that can be rescheduled, we ask you to do that. If it is something that cannot be rescheduled, please contact our transportation office at 6263, and we will do everything in our power to make that happen for you. Again, we're thinking about you. It was wonderful to see some of your smiling faces as we delivered the groceries today, and look forward to seeing you again soon.
Good afternoon. This message is mainly for our staff. So you may have noticed it's beginning to feel like we're getting a good rhythm going. It's the duties that have changed and the procedures that have changed. We're getting into a good routine. While that gives us some small sense of relief, we can't forget that there are active cases outside of our gates, and more are diagnosed every day. You all have been working really hard, and I hope that you can find some time to relax at home. Please remember, we are insisting that our residents stay on campus, and we must also insist that our staff do not attend social events at this time. In order to make sure that we do not bring the virus on site, please limit your exposure to the public by traveling back and forth to work and home and only stopping for necessities. Please talk to your family members about this as well. As much as possible, your family members should limit their exposure to the public. We must take this seriously. Our local government has put parameters in place, and we're simply asking that you adhere to them and distance yourselves as much as possible from any community spread. Many staff are posting on the staff Facebook page with steps you can take to de-stress or entertainment to help you during this time of confinement. Thank you for all you're doing and for adhering to these guidelines. Up next is the Reverend Lynn McClintock from Pastoral Care.
Good afternoon, everyone. I think one of the difficult aspects of the current crisis in our nation is how quickly our lives have changed. Even as recently as this time last month, while our country knew of the threat of COVID-19, we had no way to know how drastically it would impact our lives, our schools, our jobs, our country's financial outlook, our hospitals, and certainly our community at Westminster Canterbury. So in these very fast and uncertain and changing times, I urge you to identify those things that give you peace and a sense of emotional grounding. It may be talking or video chatting with your family or your neighbor. It could be listening to soothing music or reading or spending more time in prayer. It's probably not helpful to have the TV on 24/7. And I hope that knowing that you know that our staff is doing everything we can to keep you safe and healthy will also give you some peace of mind. Whatever it is that calms your heart and deepens your breath, perhaps write them down and remind yourself of these good and soothing things in your life. I can tell you that from a staff perspective, one of the things that helps keep our ship steady is hearing such kind and supportive words from you. Knowing that you feel well taken care of is something that grounds us, and it reminds us every day of why we are so grateful to be part of the Westminster Canterbury family. In fact, many of us have said that perhaps we had been called to serve in such a time as this. This week, when I called a resident to see how she was doing, she said, "Oh, I'm fine. I've been through the polio epidemic, World War II, Korean War, the Vietnam War, and 9/11. I'll get through this." Now, it probably helps that she is a self-professed introvert, and she doesn't mind staying in her apartment. But it is definitely full of wisdom, what she said, for us too. So think about what you have gone through in your lives, various crises in your past, and what you've learned from those experiences. At this point in your lives, life has already forced you to develop some spiritual muscle, and now is the time to use it. If you like, will you pray with me? These are words from the Book of Common Prayer. I know not what today will bring forth, but make me ready, Lord, for whatever it may be. If I am to stand up, help me to stand bravely. If I am to sit still, help me to sit quietly. If I am to lie low, help me to do it patiently. And if I am to do nothing, let me do it gallantly. Make these more than words and give me the Spirit of Jesus. Amen. Be well and God bless, and we'll see you at our next update.